Hello everyone, you're watching Physioclassroom channel, and in today's video, hello everyone, in this video we are going to learn the practical demonstration. Hello everyone, in this video we are going to learn the From here, the therapist's right hand is going to and then this traction actually has been applied to further facilitate the movement recovery outcome. Now here we have cut a 10-inch, the largest joint capsule. So these are some of the sideline position, so that the affected side knee joint is up. Side bending of the cervical or the whole spine. Therapist is going to apply a strict impulse from the posterior to anterior direction to treat the joint pain between the knees in this manner. The therapist's both hands, and also with more suitable context that any prefer. Any attempt to utilize the weaker side results in a failure, and so overly inhibit the unaffected and so will not be able to overly inhibit the left side, right side, left side, right side, left side, and as well, and I can also the superficial lymphatic flow, lymphatic pain reduction follows, or the fatigue promoting. Hello everyone, you are watching Physioclassroom channel. Required to be followed is, and in this part of the
3, 2, 1, start.
Keep learning, keep sharing, and stay connected. Learning, keep sharing, and stay connected. Keep sharing, and stay connected. Now, tissues that comprise the mechanical interface can also be considered as
बैटरी गया